Good morning. Right, now back to politics. We'll be crossing live to Wes Streeting very shortly. But first of all, lots of you have been getting in touch with your views. What have we got, Ellie?
Yeah, Nick says the way that some people treat the NHS like a sacred cow that cannot be criticised is ridiculous. Benedict is spot on. The cheerleaders say it's the envy of the world, yet no other country in the world has this model. Well, on that note, let's speak about the reforms to the NHS with the Secretary of State for Health and Social Care, Wes Streeting, who joins us now. Very good morning to you, Mr. Streeting. Good to see you. Let's talk about this report because it's damning.
Good morning, and I strongly agree with what your viewers have just said.
Well, yes. So what do you make of it saying that the NHS is a sacred cow that cannot be criticised? I mean, this report is damning, isn't it? It is being criticised. It is troubling, but none of it is a surprise. The NHS has been in dire straits for years. People know that. If they've been sat in A&E for hours on end, if they've been waiting to get a doctor's appointment for 3 weeks, if they've been sitting on a waiting list for over a year for surgery, people know this. Why have we had a report for 8 weeks of 140 pages to tell us something that we already know? The NHS is in disarray. People need to see action now, don't they?
Well, they certainly do. There are some things in it that, even having shadowed health and social care in opposition and having now been the Health and Social Care Secretary for the last 9 weeks, there are some things in there that have shocked even me, that shocked Lord Darzi, who's been in the NHS for decades, and really point to why we need not just investment but reform. Because if you look at what's happened in our hospitals, for example, staffing numbers have grown significantly since 2019, but productivity has fallen. So we are paying more and getting less. Cancer in this country is more likely to be a death sentence than it is in other comparable countries. Adults and children are less healthy today than they were a decade ago. And the importance of this report, from my perspective, and why I commissioned it, is if you don't get the diagnosis right, you're less likely to get the right prescription. And I have got now, I think, both the mandate, the evidence from the doctor, the diagnosis from the doctor about the sickness of our NHS and the sickness of our society, and from the general election, a mandate and an instruction to deliver. And that is exactly what we are going to do. We've hit the ground running in the last 9 weeks, and I hope given people confidence about the action we will take, whether that's resolving the junior doctors' dispute so that we create the conditions in which the NHS can recover, or putting £100 million into employing 1,000 more GPs by the end of this year, so that we deal with both GP unemployment and the fact people can't get a GP appointment, and also making sure that we get to people earlier with health checks in communities and in the workplaces, better for patients, better for the taxpayers. Those are just some of the things we've done in the last 9 weeks. There is a hell of a lot more to do, and the reassurance I want to give to your viewers is we are not going to duck the difficult choices, we are not going to ignore hard truths, and we are not going to sweep the problems under the carpet. And as a Labour Party, we are not going to get into dewy-eyed nostalgia about what the NHS was when it was created 76 years ago. We are going to face up to the hard choices and challenges today. So the NHS is there for us for the next 76 years, and we deal with the awful situation we see today, where those who can afford it are paying to go private because the NHS isn't there for them, and those who can't afford it are left behind.
OK, so, yeah, most people would agree with what you said. That's exactly right. You should be doing that. So where are you going to make the savings? Because there are a lot of people in the NHS being paid a lot of money. I mean, for example, I'm just wondering, I mean, do you know how much the hired paid person in the NHS is being paid and what they do?
Well, the highest paid people in the NHS, and whether that's the chief executive of NHS England, who's got a large salary and pensions package, or consultants who are some of the highest paid people in the NHS, they are paid high salaries, that's true. They do bear an enormous amount of personal responsibility and risk, and I think you've always got to get the balance right, especially in the public sector, of making sure you can get the very best people and they don't come cheap.
Okay, so
and pay them to the risk. But fundamentally, that's not, to be honest, if I can be just be clear about this, a few salaries at the top are not at the heart of the NHS's financial challenges. We've got to deal with the fundamentals.
The reason I'm saying that is because it's actually a talent manager on £520,000, £500 a year. What I'm asking really is, where are you going to redirect the funding? Because that's the issue. There are so many managers, over 2,000 managers on six-figure salaries. You've got 300 to 400 million pounds being spent each year on health tourism. So what I think people want to hear is, the NHS, we've all agreed the NHS gets loads of money. It's spending it very badly. What are you going to do about health tourism? And also the bloated system of managers who are being paid an absolute fortune, where the people at the front line are being paid less. What are you going to do about that, those issues?
We are going to wage a war on waste, and what's been interesting to me in the last few years is that the anger about waste in the NHS isn't just felt by patients who get letters through the door for an appointment that was yesterday, because of, we're still running on paper and postage and stamps in the 21st century in the NHS. It's also the staff who are working in the system with creaking IT, outdated technology, and you're right, in terms of management in the NHS, I mean, one of the things that Lord Darzi says is that it's not so much that there are too many managers, is that we need better managers and we need good management in the right places, and that's part of the reform that we need. We do need to do 3 big shifts out of hospitals into communities, so people can find it easier, for example, to get a GP appointment. Better for them, but also better for the taxpayer, because it costs 40 quid for a GP appointment, 400 quid in A&E. We've got to deal with that. The shift from analogue to digital, so we've got the latest treatments, technology, but also the IT systems that mean that we can deal with things like appointments, making it easier for patients to choose and book at the touch of a button in the health service, as we do in so many other aspects of our lives, and also shift from treating sickness to actually preventing illness in the first place. And with UK life sciences and medical technology, we've got some really game-changing stuff coming down the track that will enable us to give far more personalised support for patients, diagnosing earlier, treating faster, again, better for patients, better value for the taxpayers. So I'm not going to duck the difficult reform issues. And on things like health tourism, where we've got people taking the mick, we will tackle that. And I want to reassure your viewers about that too. We are going to wage war on waste, and not just assume that the answer to the NHS is more money without reform. Because if we did that, we'd be spending a hell of a lot of money and not seeing the impact for it. And if you're in any doubt about that, look at what Darzi said about growth in staff since 2019 versus falling productivity. We can't go on like this. The country can't afford it.
And Mr. Streeting, how is the biggest reform in NHS history going to be paid for? Because we keep hearing about this £22 billion black hole, don't we? Of which, just to be clear, £9 billion of that was for above-inflation pay rises to public sector workers, which was the choice of the Labour government, almost half of that £22 billion. We keep hearing about that, and we're also talking about these promises of not taxing working people. So where's the money going to come from?
Well, the Chancellor will set that on the spending review, but let me deal directly with the criticism you've just made about pay. On the junior doctors dispute, which had been rumbling for well over a year, and where my predecessor hadn't even met the junior doctors since March, we'd spent well over £1 billion on the costs of strike action and the consequences of more than 1 million delayed and cancelled operations, appointments and procedures. I mean, that we've spent more on the costs of strikes and the cost of failure than on actually solving the dispute. That's the thing that really frustrates me about what we walked into, is you see examples of that where the Tories talk tough but spent recklessly. And we're not going to go back to the Conservative bad old ways of unfunded spending commitments, unfunded tax cuts, more borrowing, and actually people ending up being stung in their pockets with higher taxes. That is why, and I know it's tough and it's not always going to be popular, but that's why Rachel Reeves hasn't ducked the fact there's a £22 billion black hole, and we are making the tough choices to plug that gap. It's like any sickness, and I think about the sickness in the NHS, the sickness in our society, and the sickness in our economy and public finances. The medicine doesn't always taste good, but it's a damn sight better than the alternative. And if we duck these difficult decisions and people were left paying the price of failure over the course of this Parliament and for the longer term, people would not forgive us. That was the Conservative way. It's not the Labour way, and it's not how we're going to govern the country.
Well, let's hope. Thank you very much. A lot of people will be singing from the same hymn sheet as you in terms of improving the NHS. Let's hope that the Labour government work very hard as well and also focus on people like Jazz Athwell, who is a dodgy landlord who is part of the Labour Party, and everyone's sort of gone quiet about that. Wes Streeting, thank you very much. Really good to talk to you. you.
Let's start with the Daily Telegraph, shall we? It leads with the NHS. They say does less despite record funding.
The Daily Mail, which reports NHS must reform or die, says the Prime Minister.
The Financial Times claims that Trump camp fights to regain footing after Harris delivers blows in debate.
In the Daily Express headlines, no more sticking plasters. It's reform or die for the NHS.
And finally, the Metro headlines. After 33 years, I'm innocent.
Well, joining us to go through what's making the news is Charlie Rowley and Emma Wolfe. Right, I will start. Shall we have a quick chat about what Wes Streeting said? Because he had lots of, the pill might be bad, but the medicine, blah, 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 blah.
Yeah, this torturous metaphor about, you know, we've got the diagnosis and now the doctor needs to treat us and it might be a bitter pill to swallow, la, la, la. We get it. You're the health secretary. The NHS is in a state. I mean, yes, he speaks sense, but I don't think he says anything new. I don't think this report, I mean, it's been heavily trailed. I don't think this report tells us anything that we don't know. We know that, look, we're spending more and more on less and less. As he said, there's more staff and lower productivity. Obesity is growing. The pay and pensions of the chief executives are growing. The nation is getting sicker. It's in a terrible state. We do a lot worse than other European countries. We're spending a lot more than other European countries. We had a complete disaster during lockdowns. We had a COVID-only service. We basically let people die. We let people die if it wasn't COVID. People are still dying from undiagnosed cancers, untreated cancers. The NHS is in a terrible state. This thing about reform or die, what does that actually mean? Are they going to pull the plug on the NHS?
They're not going to do that, are they?
What do they actually mean? Where's the money coming from?
Charlie Rowley.
Well, it was extraordinary, wasn't it? You know, and your fact that, you know, the highest paid person in the NHS is some sort of talent who?
Talent
manager.
Over
What?
£500,000. He was saying there's high-paid consultants and this and that, so actually it's a talent manager.
You know,
it's a talent manager.
This money, you know, should be going to the front line of services to get through that backlog that obviously was created by COVID. But what's more is that you can't just offer or cave into the unions, who are asking, by the way, 35% when the Tories were in. They got about 22%, and talk about how that is now going to reform the NHS at the very same time when you're taking away the winter fuel allowance from some of the most vulnerable people in our society who will end up inevitably having to go into the NHS, having to use the service because they're freezing, because they haven't got the ability to heat their homes. This is, you know... this is crackers.
As if basic body temperature isn't a major health issue for elderly, vulnerable people.
I mean, people will be... I don't want to sort of labour the point too much. I mean, I'm sure you have someone else to rebut Wes Streeting, but, you know, people will be sitting at home thinking that they've elected... Well, I don't know if they've elected them, but anyway, they've ended up with a government that hasn't got the first clue about what it's doing when it comes to the public finances. It is paying out to its union paymasters. Of course you need to reform the NHS. There are so many issues that we all know, and all the diagnosis, the quote there, you know, that Wes has articulated. As Emma says, it's not things that we don't already know. But I'm glad they've identified it. I hope they sort it out. But, you know, the idea that we're paying more and getting less... at the same time, where there's only going to be an increase in the backlog, at the same time of hitting the most vulnerable in our society even harder, I think people will be very, very worried, to say the least.
And people will be very, very worried about how all of this is going to be paid for, because that wasn't answered by Wes Streeting.
That wasn't. And what's depressing, Charlie, is that report, which is an important report written by a Labour stooge, basically, is really actually about blaming the last 14 years of the Conservative government. We know that. We've heard that. We've heard that almost constantly for the last 10, 11 weeks from this new Labour administration. We know that you're blaming the last 14 years of the Tory government. We've got to move on now. You've got to set out your stall in how we pay for this.
Because exactly, because the very funny is, I mean, they've fallen into the trap of paying unions and paying, you know, the doctors an increase in salary. And I'm not against obviously paying more if the money is there, and if when productivity is falling. And yet they're not seeing even more people. And yet there will be more strikes to come. If they haven't reformed the service before there's been that increase in pay, then the unions will hold the government to ransom.
And do you remember that quite startling promise from Starmer during the election campaign? 40,000 new appointments, was it every week? Where are they? From day one, there will be 40,000 new appointments. Have you tried getting an appointment with your GP recently? You know, things like that.
It's taken me 3 weeks.
Exactly, 3
I'm going
weeks.
to see a doctor today and it's taken me 3 weeks.
Exactly. Well, there you go. And those kind of promises, you cannot just fling them out there and then not deliver.